It's Patrick Hutzel from intensivecareathome.com.au, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I talked about, is it still business as usual for intensive care units when it comes to long-term ventilated adults and children with tracheostomies? You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to bring up 5 serious problems and frustrations that are not addressed for long-term ventilated adults and children with tracheostomies in intensive care. If you have worked in intensive care for any period of time, you would have seen some, if not many, long-term ventilated adults and children with tracheostomies. And if you are a family member of a loved one who is ventilator dependent with tracheostomy in intensive care or at home, you could probably write a book about the struggles your loved one and your family are going through. Whilst intensive care units are the experts in looking after critically ill patients, they are often not the experts when it comes to the management of long-term ventilated adults and children with tracheostomies who have been in intensive care for many weeks or many months. And anybody who has seen Mr. Smith in intensive care, who has been there for 6 months after he was first diagnosed with Guillain-Barré syndrome, for example, knows that intensive care is all but the ideal environment for Mr. Smith. There are a lot of needs for Mr. Smith and his family that go unmet while being a long-term ventilated patient with tracheostomy in intensive care. In fact, the issues, problems, struggles and frustrations Mr. Smith and his family are dealing with can never be solved in an inhibiting and limiting intensive care environment, yet they can be solved in an intensive home care environment. Let's therefore take a closer look at the 5 biggest problems and frustrations that I've identified over the many years while working in intensive care and also in the intensive home care environment. Issue number 1. Quality of life issues. Quality of life for long-term ventilated adults and children with tracheostomies and their families can never be achieved in intensive care, but it certainly can be achieved in a home care environment where the right support structure is in place. Number 2. Depression and lack of hope. Most long-term ventilated adults and children with tracheostomies in intensive care are depressed. They are depressed because of the environment they are in, and they are depressed because they are sick. Imagine, only for a split second, that you are stuck in intensive care on a ventilator for weeks or for months to come. Wouldn't you get depressed and even lose hope? The only solution to this massive dilemma is to provide a service that can get patients out of intensive care. Most long-term ventilated adults and children with tracheostomies and their families in a home care environment are not depressed, and they have hope for a better future. Number 3. Lack of family support for long-term ventilated adults and children with tracheostomies. Families of long-term ventilated adults and children with tracheostomies often put their lives on hold when their loved one is stuck in intensive care on a ventilator. Some family members stop working altogether during this crucial time when their loved one is stuck on a ventilator in intensive care. Therefore, a patient and family-friendly home care service gives much needed time and space back to families. Number 4. The massive costs for long-term ventilated adults and children with tracheostomies in intensive care. Recent studies have shown that long-term ventilated adults and children with tracheostomies, which fall under the categories of DRGs AO6A and AO6B, are the highest cost patient population in Australia when it comes to their care and treatment in intensive care. Other first world countries had similar problems and have addressed those problems successfully more than 15 years ago by changing care models, by changing paradigms and by creating and offering innovative services like intensive care at home in order to solve the problem for all stakeholders and ease the burden. They offered intensive home care nursing instead to long-term ventilated adults and children with tracheostomies and created win-win situations. One of the results that was created by offering a win-win situation is to establish home mechanical ventilation guidelines in order to create standards to safely offer intensive home care nursing services. Check out the home mechanical ventilation guidelines on our website. Also, you should check out this related article, Why Current Funding Models in Intensive Care Are Not in the Best Interest of Long-Term Ventilated Patients with Tracheostomies. Check it out below this video and click on the link. Last but not least, issue number 5. The lack of advocacy for long-term ventilated adults and children with tracheostomies and their families. Being long-term ventilated with tracheostomy is an ordeal. There is no question about it. Feeling unsupported and feeling like nobody understands what needs are going unmet when faced with this massive challenge of being ventilator dependent with tracheostomy is probably even worse. There is very little or no advocacy in Australia for this patient group and their families, even though there is a growing number of people requiring services. Intensive care at home not only provides services to this patient group and their families, we are also advocating for long-term ventilated adults and children with tracheostomies. What are your thoughts? Can you think of any other serious problems and frustrations that have not been addressed in intensive care for long-term ventilated adults and children with tracheostomies? Leave your comments on the blog. Please also note that intensive care at home has been selected as a preferred provider for Queensland Health Services. We are also currently hiring enthusiastic and experienced intensive care nurses with critical care certificate for a ventilated Melbourne client close to the CBD. For more information, check out our career section. You can also contact me on 0410942230 if you want to know more about how we can help you, your intensive care unit, and your patients and your families. Thank you for tuning into this week's blog. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you again in another update next week.